Funding for this program is provided in part by the Minnesota Arts and Cultural Heritage Fund and the citizens of Minnesota.
Coming to you from Rochester, Minnesota, our town.
We are checking in today with Program Manager Meaghan Sherden and Mike Melius, Associate Director of Public Health in Olmsted County Public Health, to get us up to speed on what we need to know about the latest surge in COVID-19 cases in our community and what we can do to keep ourselves and our community healthy during this time. Welcome to our town.
Thank you.
Thanks for having us.
So I think a lot of folks are hearing a lot. I mean, we're hearing about the cases nationally, locally. Can you tell us a little bit about what the positivity rate currently is in our county and how does this wave compare to what we've seen before?
I can take that one. So right now, our positivity rate is around 30%. So that means 1 out of every 3 tests are coming back positive. Typically, we want to see that positivity rate around like 5%. So that just even shows you right there, like the sheer volume. I will also say we have not seen testing volumes like this the entire pandemic. Our healthcare partners are processing over 10,000 tests on Olmsted County residents alone for the last few weeks. Typically that it's been around 4,000 to 5,000. So we just even know, even looking at some of that, much higher. We thought we were hitting some of our pandemic highs a few months in November when we hit 1,000 cases. The past few weeks, we've been 1,000 plus. Then the week after that, we were 3,000 plus. And then this week, we're close to 2,700 cases. So there is just a ton of COVID in our community right now. But we also know that's an underrepresentation because of all the at-home testing going on. So I think we've not seen this the entire pandemic. And it feels like week after week, it's new record of positivity rates, new record of cases, new record of hospitalizations.
Yeah, I think that certainly gives us a good sense of just how different it is and how staggering it is as well. Can you talk to us a little bit about the impact that this surge is having on our local healthcare system and our capacity at this point?
Yeah, so what we can talk about is what we know from our end of Olmsted County residents. So it's important to know we have 2 great healthcare facilities in our community, and they are kind of a hub for a lot of other regions or other counties in our community. So we can talk about what we know from an Olmsted County perspective, but it's not necessarily the full picture, if you will, of what's happening. What we know is for the past few weeks, we've seen our hospitalizations increase, usually by 3 or 4 every week. So we're actually hitting pandemic high hospitalizations. So for example, this past week, we had 48 people in the hospital and 3 in the ICU. So I want to talk a little bit about the ICU because that's maybe, if we want to call it a bright spot. As our hospitalizations have been going up, our ICU utilization has remained stable. So that's a positive. So we also know that we're not seeing the strain maybe on just like we're seeing on hospital beds in the ICU.
Meaghan, can I ask you a follow-up question to that? Does that sort of that stability mean that are the cases as serious as they were before? Can you talk to us a little bit about that?
Yeah, so there's a lot of factors that go into it. I think and even talking with our healthcare partners too, what we see as an ICU case is typically much more severe than a lot of other hospitals. So we have just such a high level of care that we also haven't seen the high ICU rates that others have because the really, really sick are going there. What we are seeing though with our hospitalizations is people bopping kind of into the ICU, then going out into the just to a hospital bed and then kind of coming back. So there's a little bit of fluidity happening there. However, we kind of, the narrative that has been with Omicron is that it's not as severe. What we're seeing though is it is driving a lot of people to the hospital, especially those unvaccinated, but then also those who potentially are vaccinated just have really a lot of underlying health conditions. And that's who we're seeing in our ICUs at this
point. So we have 1 minute before the break here. Can you just talk to us a little bit about some of the factors that are impacting the current surge in cases?
Omicron hit at like the worst time possible, I think, for everyone, because it happened right during it came much earlier than I think we were all anticipating. And B, it happened right during all the holidays with it starting to, and it's starting to get colder. So we saw a lot of people gathering together, and a lot of them tried to do all the safety precautions, but because of Omicron and just how infectious it is, you could do all what you can, but there's still opportunities for that infection to happen.
Yeah, definitely. Thank you so much for joining us, and we will be right back with you after the break. Be sure to stick around. We have much more coming your way on Our Town. We visit Treedome, a new storefront, vinyl shop, and production studio on Broadway. We also continue the conversation with Olmsted County Public Health. But up first, we head to Rochester Art Center to explore the Homecoming Queen exhibit, inviting visitors to explore the wonderful world of Utica Queen, star of season 13 of RuPaul's Drag Race, in this week's Our Culture segment.
My name is Brian Dukersheim. I'm a board member here at the Rochester Art Center, and I am one of the curators of Homecoming Queen, The Wonderful World of Utica Queen, an exhibition that is now on display here at the Rochester Art Center. Utica Queen is the drag persona of Ethan Mundt. Ethan was born and raised in Utica, Minnesota, a town of less than 300 people, about 30 miles east of Rochester. And he started getting into drag when he was in college at Hamline University in St. Paul, and began his professional drag career in the Twin Cities. Last year, he got on to the season 13 of RuPaul's Drag Race, where he quickly won the hearts and affection of people around the world.
She's sickening.
All of the costumes that Ethan wears are made by himself and his team. So as soon as people come into the exhibition, this is the first piece they see. This is Ethan's promo look. So on Drag Race, when the cast of each season is announced, the show releases a bunch of publicity photos and promo videos of the contestants. And so this is actually a really good example of a lot of the themes within which Ethan works. So you can tell there's a little bit of a milkmaid, farmer's daughter thing going on here. A lot of Ethan's drag he does reference growing up on a farm in Utica. You'll also see that the color is split between the blue and the yellow. Ethan is a really big fan of exploring themes of duality. And then you'll see at the top there are 3 hats sort of stacked. He also likes to work in triplicate, which is actually a reference to the Holy Trinity. Ethan was raised Seventh-day Adventist. So this is Cathedral, which is inspired by religious architecture. When I learned that Ethan conceives, designs, and sews all of his costumes himself, that's when I really was interested in approaching our executive director about mounting this exhibition. So this is, without a doubt, the most important piece in the exhibition. So this is Sleeping Bag. This stunning piece was made out of 5 sleeping bags. Ethan made it in just one day. He made it in about 8 hours. Those perhaps of a certain age may remember back on the Carol Burnett show, there was her very famous parody of Gone with the Wind called Went with the Wind. And there was a scene in which she referenced the character of Scarlett O'Hara making a dress out of the curtains at Tara, the Southern plantation.
What brings you to Tara?
And so this is Ethan's interpretation of Carol Burnett. Drag is about self-expression, it's about creativity, it's about not taking the world and its rules too seriously, it's about breaking those rules, it's about stepping outside of gender norms and poking fun at gender norms. It's about artistry, it's about performance, it's about community, it's about laughter, all of these things, which I think in our current day and age, we could all use a little more of.
For more information about this story and other Our Town features, connect with us on Facebook, Twitter at KSMQ #OurTown, or ksmq.org/OurTown.
Hello, I'm Danielle Teal, your moderator with Our Town Spotlight. This segment covers organizations, events, and happenings across Rochester, as well as really important information like today. We're going to talk about taxes. I know, that could be a stressful topic. We'd like to thank 125 Live for hosting today's show. Today we have David Oeth with Volunteer Income Tax Assistance Program. Welcome, David.
Welcome.
And very excited to have you on because taxes, everybody gets stressed out just by the word, I think. I know that I am always in anxious anticipation of it. So let's dive in a little bit about the taxes for 2021 and what people should be aware of that is a little bit different this year.
Sure. As always, the taxes are an opportunity to sort of look at your finances and all. It's also an opportunity to obtain credits that people are allowed. And a lot of changes this year. There's probably 4 significant credits that you want to take advantage of by filing. There's an economic impact payment of $1,400 last spring. If you didn't get that, you can get it now by filing. There's a big change in what's called the child tax credit. They increased it from $2,000 to up to $3,600, and now it's all refundable. And so a lot of people want to file for that. Some of you might have gotten that in advance payment starting in July, and you need to file the return to get the balance of your credits. And then a big change is the child dependent care. This is your daycare expenses. They increased the expenses from $3,000 to $8,000, and that can now be refundable. So a lot of reasons why people would want to file even if they don't have any taxes to pay. And one final change is for people over the age of 64 who are still working. Now they qualify for what's called an earned income credit. And I looked at an example, somebody made $10,000 with no other income, and they're getting back $1,500. So there's a lot of reasons to file besides, paying Uncle Sam their fair share.
Right, and people shouldn't get too scared by it because there are resources available to help, even if it is confusing and there's not clear understanding what to do. And what ways can people look into getting those resources?
Sure. Our VITA program involves over 75 volunteers that are there to help people who lower to moderate income people, 75,000 or less, who otherwise might struggle. And they could call 211, which is the United Way referral area, and get connected. We offer 6 sites. We also go to 14 senior sites. And we can't do it without these 75 volunteers. And also our program sponsors are 125 Live and Salvation Army and all the wonderful sites that allow us to come in and help these people. So
that's wonderful, David. You all are doing important work. So thank you so much.
We enjoy doing it. We're awesome. Odd in that way. We like taxes.
I know, right? Well, thank you so much for being on the show.
All right. Thank you, Dino.
Hello again, this is Michael Wojak with your Our Town Rundown. As you are likely well aware, we are in the midst of a pandemic, and as such, the City of Rochester has put in an indoor masking requirement in public places in place through at least February 7th. This was affirmed by a supermajority 6-1 vote of the Rochester City Council. In addition, both Olmsted County and Mayo Clinic has expressed support for this policy, and we just ask that you continue to do your small part in keeping others safe. Additionally, covidtest.gov is now available. You can go to that website and get COVID tests delivered to your home for free. Coming up on February 1st, it's caucus season in Minnesota, and irrespective of your political affiliation, you can go to the Secretary of State's website and find a tool that will tell you where your caucus, for whatever party you're interested in, is going to be held at this year. Coming up at Rochester Art Center on Saturday, there is a book launch and fundraiser with Boomy McElroy, and that's going to be, again, 2 p.m. at the Rochester Art Center. If you're into monster trucks, 2X Extreme Racing presents Monster Truck Chaos 2022 at the Mayo Civic Center. There will be candlelight hikes coming up a couple more times this year at Quarry Hill. The next one is going to be on January 28th. That's a great outdoor activity, and you can purchase tickets with different starting times to reserve your spot. Radium Girls is a production being put on by the Repertory Theater. There's a show on the 22nd and additional shows coming up as well. So if you're interested in that, those tickets are available. And finally, the Rochester Grizzlies, our amateur hockey team, is sitting in first place in their division with over 30 games played. They will be home both this weekend and next weekend if you want to catch some amateur hockey action. And that's just a little bit of what's going on in Rochester.
Hello, I'm Danielle Teal with Our Town Walkabout, and we're talking to our guest remotely. I'm in my house, and Nate Nelson is in a brand new location fun store. He's going to dig into it a little bit. It's called Treedome, and it's a creative studio and shop downtown. Hey, Nate, how's it going?
Hey, Danielle, how's it going?
I saw all the photos on Facebook from start to finish.
Yeah, we used to be located downtown in Winona for about 5 years. And then we moved up here back in March and got to work renovating the old Big Brad space here into the shop it is today.
What inspired you to move locations and to basically set up shop in Rochester then?
I'm a videographer and photographer by trade. So I do a lot of like music videos and live sessions and shows, and I work with a lot of bands. And a lot of that involves travel. So when we were in Winona, I'd be traveling to Minneapolis, to Rochester, to Madison. Being located in a little bit more of a central location in Rochester made it easier for us. But from a shop perspective, there's a lot more people here than there are in Winona. But when we're moving here, we're like, well, we need to have a studio. We need to have a space. We decided to kind of just go full throttle with the shop stuff.
Very cool. Well, we would love to scope out the store with you. If you could give us a little tour.
First thing is we've got records, so we have them all organized by genre. So we've got a bunch of old stuff like vintage pop, rock, hip hop, metal. Local music is a big thing for us because we work with so many local bands. From the vintage, that's kind of the other big half of what we do. And then we also do skate stuff.
That's really awesome. And did you just loop me into the young crowd? I think you did.
Come stop by.
Perfect, sweet. I will stop by. Thank you so much for being on the show.
Yeah, of course. Thanks for having me.
Thank you. This is Danielle Teal with Our Town Walkabout.
Welcome back, everyone. We are spending the half hour talking to Program Manager Meaghan Sherden and Mike Melius, Associate Director of Public Health from Olmsted County Public Health, about COVID-19 and the current surge in cases. Before the break, we were talking just about kind of getting our heads around what the situation is and how different it is from anything we've seen before. And the next thing I want to talk about is vaccination and what percentage of the county is fully vaccinated and what is the county doing to continue to facilitate boosters. We know that that's a big thing, as well as full vaccination for both children and adults.
Right. Yeah, we've Olmsted County, at least as our county, when we look at statistics, have led or been like the second leading county in the state in terms of vaccination rate. We fully understand that we benefit greatly because of the health systems we have here. Early on, they were in the first priority groups. We had a lot of healthcare workers get vaccinated, and that has followed on through with continuing to vaccinate the population. Vaccine is one of the best tools we have in the toolbox right now to fight this pandemic. And we're so glad to be able to continue doing that work. Olmsted County Public Health has been hosting vaccine clinics since the beginning of 2021. We've been coordinating with our healthcare partners so that they're able to provide in the locations and in the way that is best for them and their patients and customers. And on our side in public health, looking at opportunities in the community for populations or groups or businesses, for example, that maybe need a type of service that we can provide going out on site or just within the capacity that we have too. So it's been a coordinated effort. We are so grateful for our healthcare partners and the ability to coordinate that. We know that vaccinations continue, and it's really important that we continue providing it and helping people understand how important it is to get vaccinated. Right now, more of our targeting that we're trying to do is get into, like, for example, schools and make that an accessible route for children, especially the ages 5 to 11. We continue, though, providing vaccine to all ages, 12 and older, especially boosters in that age group, 12 and older. So we're trying to find a way to get as much vaccine available to the population as possible. We know that vaccine was very important in protecting against the Delta variant. We also know now with the Omicron variant that being fully vaccinated with a booster dose dramatically reduces your risk of severe illness and hospitalization. So now more than ever, with this big rise in Omicron cases, to try to get that vaccine and make it available, we're expecting people are looking at that, and if they haven't been vaccinated yet, they are choosing to do that and or get a booster.
So the city of Rochester also just issued a masking mandate in public areas. And we know vaccinations, we know masking. We've sort of run through kind of like all of the things in the last couple of years that are supposed to help us keep ourselves and our community healthy. Masking, of course, being a big one, as well as vaccination. Can you just remind us of just some quick tips on proper masking? I know we've all been wearing them, but just kind of remind us as we're sort of gearing up or just sort of in the thick of this storm right now.
Yeah, exactly. We recommend, kind of as people approach indoor environments, taking a multi-layered approach. Wearing a mask is a very important part of that. Wearing a close-fitting mask, cloth mask, is fine. We talk a little bit about other options, but something that covers your mouth and nose, well-fitting, and if to the degree possible, you can feel that it's maybe capturing and moving with your breath, it's close fitting.
Thank you for that guidance and reminder. We've also, things are changing, and I'm sure you're living it. Things are changing almost on a daily, hourly basis. Nationally, we now have, as of this week, the at-home testing kits available to households. What guidance can you provide on how to access those and when to use them at home?
Well, I think it's a great opportunity. We know that at-home kits are an important part of the solution in making sure people have tools to understand if they're positive for COVID. The website that you're talking about through the U.S. Postal Service is covidtest.gov. I think it's a great opportunity for every household to go online and order that, get that 4-test kit package. It will be mailed to you. My wife, in fact, just did it for our household and took her 30 seconds, she reports. So I'm going to believe her. And I think it's a great way to have that available so that when you're in a situation where you need to know if you've maybe been exposed or you're going to be joining other people that are vulnerable, maybe at risk of a severe illness, or you're going to a gathering or something along that lines, you can know if you're positive and take actions accordingly.
I love that. I love how you said just sort of amassing those tools to empower all of us to stay healthy and keep each other safe. I think that's really important as we're sort of, I think that there is a lot of, fatigue around it and, a little bit of a burnout around just hearing the same thing and the waves keep coming in. So I think, thank you so much for sharing that and just reminding us of all the tools we do have at our disposal to be able to get through this. Is there anything else that you'd like the community to know about the current COVID situation and just resources that are available, and just any way that the community can connect and can stay up to date with the efforts of the county?
I can touch on some of the resources too. So Olmsted County, our website, has a whole page dedicated to COVID. About the current situation of seeing where we are for case numbers. We actually link to MDH and the CDC, so you kind of get a nice dashboard all there for the current situation. We also try to keep it as most up to date around testing, and we just added information around at-home testing because I know that's that has been a big question for our partner, for our community. We also talk about vaccine and where you can access information too. We also just restarted our COVID-19 newsletter that goes through our Gov delivery system that you can sign up on the website too. And that is kind of just a weekly update to provide current situation and just kind of talks through the hot topics of the week, which there can be so many. So, but it's just a really good digest of everything that's going on. And if it's just more for a reference of like, oh, they talked about masking here, and here's a good article around that. So there's a ton of information that is getting pumped out, but we just try to consolidate that all for our community once a week. And those come out on Fridays.
Wonderful. Well, thank you both so much for joining us. Thank you for all you're doing to help keep our community safe. And I'm sure we'll be catching up with you in due time.
Thank you.
And thank you all for joining us today. For more wonderful content produced right here in Rochester, please be sure to follow us on Facebook and Twitter at #OurTown. I'm Nicole Nfonoyim-Hara, host of Our Town, the show about Rochester. Be well and stay safe, and I will see you next week.
Funding for this program is provided in part by the Minnesota Arts and Cultural Heritage Fund and the citizens of Minnesota.